latest enrollment numbers are in, revealing just 1/3 of the amount of enrollees expected by now. Some House lawmakers were visibly frustrated.
Knowing what you know today, you would have started the launch October 1st?
I would have probably done a slower launch, maybe with fewer people, and done some additional beta testing.
Who is going to guarantee that the doctor that sees that patient on January 4th is actually covered for that visit?
The insurance company that, as they do today, you are enrolling in a private insurance plan.
What
you
if
have
that
to pay
patient
your premium
doesn't
in order
make
to be
the premium payment? You said they're covered December 23rd, but they never write the check. They never make the payment.
Then they're not covered.
You know, this whole idea of, the president saying if you like it, you could keep it. I mean, the president didn't say that if you had a lousy health insurance policy that didn't cover everything, that he was suggesting that, insurance companies continue to sell it and therefore you buy it.
You cannot say, as you had numerous times, that these preventative care services are, quote unquote, free of charge, can you?
They are free to the consumer, yes, sir.
They are not. There is no free lunch, Madam Secretary.
North Carolina Congresswoman Renee Ellmers was asking some of those questions today. Congresswoman, thanks for being here. Great to see you.
Good to be with you, Allison.
What did you learn today?
Well, unfortunately, a lot of more of the questions that we go into, now I have more questions. We aren't getting any reassurances of how come January 1st all of this will be paid for. You saw the Secretary take the opportunity to once again put the ownership on the insurance companies for who will be paying for these things. Will our doctors be paid? Will there be coverage for those individuals who think that they have purchased health care plans? As you pointed out, we have a couple 100,000 that have enrolled in coverage, but yet we have over 5 million who have had their health care plans canceled. Yeah. So this is just very, the numbers don't add up.
I want to get to those numbers because Secretary Sebelius today testified that as of November 30th, 365,000 people selected a plan. Those are her words, selected a plan. Do you know exactly what that means? Are they fully enrolled? Have they paid their money?
No, and that's exactly the point. As she pointed out, and as my colleague Dr. Burgess was asking very plainly, if these first payments haven't been made, then that means that there isn't coverage. Who is ensuring that? That there again, now we've opened up yet another question, another area, another gray area, essentially, where this is concerned. We end up walking away from these hearings with the Secretary with more questions than answers.
Right. It's not supposed to work that way. So where do you go from here? I mean, how will you, if you can't get the answers from Secretary Sebelius, who's spearheading it, what will you do?
Well, we are continuing to stay on this issue. We keep highlighting our constituent situations. I have a mother of two back in North Carolina whose health care coverage is going up $4,400 a year, and she makes about $40,000 a year. How can we continue this? I think the best Christmas present we can give the American people at this point is a delay of Obamacare. I think we can give the American people some assurances at Christmas time. For my constituent with two children, she doesn't know how they're going to have Christmas.
But is there any groundswell of support for that? I mean, we hear a lot of people, Republicans, talking about a delay of Obamacare, but it's already in place. So,
well, exactly. I mean, we even passed it to avoid the government shutdown. Let's just delay it for a year so that we can work these things out. We continuously ask these questions. I asked her very, very plainly, the president said if you like your doctor, you can keep your doctor, period. Are you going to reassure the American people now, today, that they can keep their doctor? And of course, she couldn't do that. So you see how this is playing out. This is not good for America. This is very bad for health care. This is not good for the economy. And we've got to come up with an answer here. And we, of course, have passed that legislation to keep your health care plan if you like it, and a delay.
Congresswoman Renee Ellmers, thanks so much for giving us your take on today's hearing.
Thank you, Alice.